Okay, so now we will be comparing the muscles of pelvic floor as well as muscle of mastication. So these both muscles have different nerve supply, but we are going to compare them just to memorize them in better way. So as you can see, muscle of pelvic floor includes pelvic diaphragm, includes levator ani muscle, coccygeal muscle, iliococcygeus or ischiococcygis. So levator ani along with puborectalis, pubococcus, iliococcyx. These are three muscles of levator ani, and there is coccygeus muscles like ischiococcygis muscles are forming pelvic diaphragm, and they support structures of pelvic, especially in the female after pregnancy. Nerve supplies from pudendal nerve S2, S4. So after spinal anesthesia, the block is up to level of the S2, S4, and a saddle block is done in perineal surgeries are done on these. So these muscle of pelvic floor has direct nerve supply from sacral branch. Function is support pelvic and maintain urinary fecal continence, resist increase intra abdominal pressure while cuffing or lifting heavy weight, important in childbirth and sexual functions. So these are some very important functions of muscles of pelvic floor. What are the muscles of pelvic floor? Like iliococcygeus, ischiococcygis, and puborectalis. These three muscles, levator ani, and these muscles are main support for pelvic floor, and nerve supplies from S2, S4 pudendal nerve, and weakness results into prolapse, incontinence, and damage in childbirth is common. Puborectalis maintain anorectal angle and continence, and now comes muscles of mastication. These are different muscles and very important, like muscle of mastication include temporalis and these muscles of mastication include masseter, temporalis, medial pterygoid, and lateral pterygoid. Masseter is elevates the mandible, temporalis elevates and retracts the mandible, and uh, the medial pterygoid elevate side of the mandible, and lateral pterygoid opens the mouth and helps in protrusion. So this is very important thing, that what muscle is elevating the mandible, what muscle is helping in elevation and retraction, what muscles help in opening the mouth like lateral pterygoids and medial pterygoids. So closing of the mouth is done with the masseter, and also elevation is there is function of temporalis as well. So lateral pterygoids are like retraction and protection. So this image, as you can see, are very important for movement of the jaw and mandible. Nerve supplies from mandibular branch of trigeminal nerve, which is supplying. Trigeminal nerve has three branches: ophthalmic, mandibular, and maxillary. Mandibular branch of trigeminal nerve supplies these muscles, and their function is the chewing, mastication, elevation of the mandible, depression of the mandible, protrusion and retraction, and the side grinding of the mandible. So there is clinical importance, like this function are displacement of TMJ, temporomandibular joint, can happen. Trigeminal nerve lesion results in the chewing problem. Lateral pterygoid opens the mouth, and masseter close the mouth. So masseter close the mouth, and lateral opens the mouth. This is very important thing to memorize. As you can see, final is the pelvic muscle has supply of the pudendal nerve and S2, S4, and a muscle of mastication is a nerve supply of the mandibular nerve, and the maxillary nerve has different function, and ophthalmic is also different function. So these are very important things. You have to memorize it, and you have to understand the anatomy of normal muscles, and anatomy of different